Mental health is in crisis, and the World Health Organization is sounding the alarm, urging nations to drastically increase their investment in this critical area. But here's where it gets controversial. While some countries are heeding the call, others are struggling to prioritize mental health amid competing demands. For instance, in the midst of Europe's most severe drug epidemic, Glasgow is taking a bold step forward with the UK's first supervised drug clinic. A move that health officials claim is saving lives. Yet, they're still battling to win over skeptical locals, raising questions about the balance between public health and community acceptance. And this is the part most people miss. The clinic isn't just about harm reduction. It's a lifeline for those trapped in addiction, offering a chance at recovery in a safe, controlled environment. Meanwhile, the UN is issuing a stark warning: adapt or die. Workers, the largest group vulnerable to climate change, are facing unprecedented risks from extreme heat in the workplace. This isn't just about discomfort, it's about survival as occupational injuries and health risks soar. But here's the counterpoint. While the UN calls for urgent action, critics argue that implementing workplace adaptations could strain already struggling economies. Is it a necessary cost, or a luxury we can't afford? In Gaza, the situation is even more dire. Doctors are fighting a rare paralytic illness with limited resources, all while operating under the constraints of an Israeli blockade. And this is where it gets even more contentious. Israel's destruction of sanitation systems has allowed dangerous viruses to spread unchecked, exacerbating an already dire humanitarian crisis. But here's the question: is this a deliberate tactic or an unintended consequence of conflict? Adding to the turmoil, Israel has threatened to ban 100 aid organizations from Gaza unless they disclose details of their Palestinian staff, leaving Palestinians on the brink of starvation. This raises a critical question. Are humanitarian efforts being weaponized? And if so, what does this mean for global aid ethics? These stories aren't just headlines, they're a call to action. What's your take? Do you agree with the measures being taken, or do you see a different path forward? Let's spark a conversation in the comments.